Welcome to At Home. A little later on in the show, we're going to take a look at creditor insurance. But first, a real fascinating topic.
Yes, we are going to talk, of course, we know a lot of issues of fertility and infertility problems. We have a special guest here today, Lindsay Eastburn, who is a board-certified hypnotherapist. But we're talking about helping people become pregnant with hypnotherapy. And this is your book. It's called It's Conceivable.
It's conceivable. Yes, that's right. Oh, it's conceivable, all right.
Yes, it is.
Yeah.
And again, we talk about how this is actually, you have actually helped people get pregnant before.
Yes.
And you have, as you were saying, you have loads and loads of babies, but they're not all yours. It's because of patients that have come into your clients, have come in, and you've helped them out. How does this whole concept work?
Yes, well, I actually utilize hypnosis to help women to become pregnant. There's about a 25% diagnosis of unexplained infertility.
Wow.
That's
a high number.
Yes, it is, of women who have gone in for a workup to find out about their fertility. And some of them choose to do medical procedures, and the hypnosis is an adjunct to that. It really helps them to have a much better, more positive experience with that. And then also what I noticed was happening was they would come in to see me, and before they got around to getting a chance to have the medical procedure, they were getting pregnant naturally.
But let's face it, a lot of times there's a lot at work here, right? Stress, pressure. Sometimes you can be trying too hard, right? And all of a sudden you're able to take a lot of that anxiety away through hypnotherapy, right?
Right, because people are talking about trying to get pregnant, and the subconscious mind learns very early on that trying means you don't actually have to do it. You know, you try to tie your shoes when you're 3, but if you can't, someone is going to tie them for you. You're not going to be left around to trip over your shoelaces. And so the subconscious makes this connection that as long as I try to do something, I actually don't have to do it. So we want to actually remove that word even from the entire process with just, I've decided to become pregnant, or I'm embracing the pregnancy, that type of thing, just to connect in with the way that the subconscious mind responds to that type of thing. And then there is the stress that people are asking questions, and they're telling stories, and they're projecting, and they're giving statistics, and oh, don't you know, oh, you're 35 already. And so constantly,
sometimes your parents can be going, when are we going to have a family?
Where's our grandchild? And every time you see them, or the minute you walk down the aisle and you haven't even thrown the bouquet yet, and they're asking, you know, when's the baby coming? And we know that even when we have a first one, the first question out of people's mouths is, when are you having the next one? And so there's a lot of pressure there.
Have to stop asking those questions.
Yeah, I know.
But it's true, though. You know, it's amazing how 35 is considered as like you're kind of an older mom, and that's just crazy.
Sure.
And so people do hear that, and they do start to kind of panic because people are telling them, oh, well, your eggs are getting old, and whatever, and you better hurry up, and you should have your children young, and that's a lot of stress. Plus, just the everyday stress is a lot of women are working now. Right.
Well, and there's pressure to get through university, to get the career going. 35 is considered medically high risk, so women are expecting that, or if they haven't heard that, they're immediately traumatized by getting this going into the doctor's office, and they're saying, oh no, you're a high risk. Immediately, that's what we call in hypnosis a painted word. It has a real kind of wham to it, and it causes emotional stress. So when you hypnosis works on compounding. So if we've got some fears that maybe started, sometimes we have fears of childbirth, or fears that maybe we're not going to get married or not going to have a family, and then it gets compounded longer and longer, especially if we wait till we're 35 or 40 to start a family. Then all of a sudden, all of the medical interventions that are there now. It used to be, you got married and then, it was kind of a personal decision if you maybe were going to use birth control or not. Now it's like, well, we'll be married for this long, and then we'll go see the doctor, and we'll get the workup, and we'll find out if we're ready to get pregnant. It's almost like there's a condition on it.
And let's face it, I would imagine that a lot of times when people come to your clinic, they're feeling rather desperate because they've already been told, or they've already been through a period where nothing's happening, and they're starting to feel rather defeated, right?
Oh yes, and with hypnosis, so often we are the last hope.
I was just going to say, what stage it really is the last hope, right?
Yes.
So they've done all the in vitro and everything at this point.
Right. A lot of times they have, or they're not sure they want to do the in vitro because they're not sure about that whole process. In vitro can be very difficult, painful, a lot of hormonal issues with that. And some people, it's not maybe in harmony with their spirituality or their the choices that they want to make, or they've had several failed in vitros, and then it's expensive, and insurance. And I know it's a little different maybe in Canada than the U.S., but insurance doesn't typically cover it, or there's a lot of payments that have to be made on the part of the couple.
And how many times do we hear of couples that have been trying, all the pressure, all the stress is there, and then they've given up? And as soon as they give up and believe that there's no hope, that's when they become pregnant, right? Because the stress has been taken away. But with your process, you're doing that in advance of trying, right?
Exactly, because and people dealing with fertility, I call it fertility because infertility, again, we're reinforcing that negativity.
Sure.
So fertility, we want to put out there that we're, conceiving, getting pregnant. So some of the times what happens is people are just used to that they're expecting that they're not going to conceive.
All right, you know what? We're going to talk a little bit more and find out what happens when somebody comes to your office. More with Lindsay Eastburn and hypnotherapy for fertility when we come back.